Hello, and thank you for taking the time to view our presentation where we will cover the Humana Group Medicare Employer Plan for State of Louisiana retirees. Today we will discuss Medicare, your plan, enrollment, your care, and extra benefits and resources. Medicare. How does Medicare work and how is it different from Medicare Advantage? Medicare is the U.S. government's largest health insurance program serving more than 59 million people. It's run by the Centers for Medicare and Medicaid Services, also known as CMS. It's part of the U.S. Department of Health and Human Services. Medicare is divided into parts. Parts A and B are original Medicare. Part C is Medicare Advantage. Medicare Part C covers everything Parts A and B cover, including hospital and medical services. You still have Medicare if you elect Medicare Part C coverage. Part D is prescription drug coverage. Your plan. What is my plan and how does it work for me? This plan allows you to pick one primary care provider, PCP, in Humana's network to help you organize and manage your care. This provider knows you and your medical history and will help you get the care you need. However, with an HMO, you must see a healthcare provider who participates in Humana's network for your care. To check if your preferred provider is in Humana's network, you can go online to humana.com and use the physician finder. With every Humana employer plan, you will have no copays for preventive care, you will have an out-of-pocket maximum, and you will have worldwide emergency coverage. So with your red, white, and blue Medicare card, we suggest that you keep that at home in a safe place because from now on, you will only provide your Humana ID card at your provider's offices and at your hospitals. This plan has a $0 annual deductible and a $2,000 annual maximum out-of-pocket. We've also broken care into hospital versus non-hospital so you can see what you will pay for each item. The annual maximum out-of-pocket is the most that you will pay for your coverage services throughout the plan year. If you reach $2,000, the remaining medical expenses are covered by Humana at 100%. With your Humana plan, you have access to network mail delivery pharmacies, including Humana Pharmacy. Mail delivery pharmacies can ship your medications to your door and often remind you when it is time to refill your prescriptions. We've mentioned mail delivery pharmacy and Humana Pharmacy mail delivery, but let's go into more detail on exactly what you get by using Humana Pharmacy. To start off, 2 pharmacists check every order that goes out to ensure they are safe and accurate. The drugs get shipped right to your door or provider's office, whatever is most convenient for you. And if you have questions, there's a team of pharmacists and technicians only a phone call away. Additionally, Humana Pharmacy reminds you when your prescriptions need to be refilled. They can call you, email you, or text you, whichever you prefer. Call us with questions at 1-888-538-3518, Monday through Friday, 8 a.m. to 11 p.m., and Saturday, 8 a.m. to 6:30 p.m. Eastern Time. Humana is proud to offer prescription drug coverage to help serve retirees' needs. Our PDP plan provides many features that may make filling your prescriptions easier. It comes with additional member-facing benefits, including coverage for your specialty medications and access to a mail-order pharmacy. The important thing to know about our PDP plan is that it gives you coverage for all drugs that are approved by CMS. The way coverage works with Part D is that each of the major types of prescriptions are broken out into categories or tiers. The tiers are typically broken up by whether the drugs are generic, preferred, brand, or specialty. You will pay different amounts depending on what type of drug it is, and another factor that determines the cost of your medications is whether you get a 30-day or a 90-day supply and whether you pick up your prescriptions in person from a pharmacy or use a mail delivery pharmacy like Humana Pharmacy. To the right, there are some example medications that fall into each category. Enrollment. What do I do next? What do I have to do to enroll in this plan? If you would like to join the Humana plan, you just need to complete the form in the booklet OGB sent to you and send it back to OGB. They will notify Humana of your enrollment. You can also take a look at the materials OGB sent to you and compare both benefits and monthly premiums so you can make an informed decision on what plan is best for you. Your care, what to expect after you enroll. After you're enrolled, you will receive an enrollment confirmation letter. This letter confirms that the Center for Medicare and Medicaid Services confirmed your enrollment in the Humana plan. Then you will receive your Humana member ID card. This arrives in the mail approximately 2 weeks after you are enrolled. You will also receive an evidence of coverage booklet. This is a detailed booklet in the mail that includes your healthcare plan coverage and privacy notice. Then you will receive a Medicare health survey. This is an optional survey that CMS requires Humana to ask new members to complete within their first few months of enrollment. Instructions on how to complete the survey are included in the booklet mailed to you. Humana's online provider directory is a convenient way to find a current list of hospitals, doctors, and other healthcare providers in Humana's network. You can locate the Find a Doctor tool by clicking the Find a Doctor tool on the homepage at humana.com or on the My Humana mobile app once you are a member. Humana's group Medicare plans address the full spectrum of your health needs, from overcoming a chronic condition or supporting your journey towards better health and security. One of the biggest advantages of Humana's Medicare Advantage plan is your access to additional programs at no additional cost to you. Silver Sneakers allows you to join any of their nationwide network of gyms. You can check them out on silversneakers.com and find any gyms in your neighborhood. On Go365, you earn dollars that can be redeemed for gift cards in the Go365 mall. You earn dollars by doing preventive activity, physical activity, or any social activity. You can check them out at Go365.com. My Humana is your online portal where you can check the status of your claims year to date, track your healthcare spending, set your preferences for mail and items such as My Directives. My Directives is an end-of-life care planning tool where you can set your preferences for items such as donation, organ donation, autopsy, and you can share these preferences with your family, friends, or your providers, whomever you feel should have access to this information. Next is the Humana Well-Done Meal Program. After you've had an inpatient stay in a hospital or skilled nursing facility, you're eligible for up to 28 meals shipped to your door after you're released from the hospital. Humana at Home is our care manager program. If you're paired with a care manager, if you have a chronic condition, they can help you understand your doctor's advice. They can help find ways to afford your medicine, and they can help arrange transportation to and from your appointments. After you enroll in our plan, we want to make sure that we are there for you if you have any issues, questions, or concerns. That being said, we have multiple ways to stay connected with Humana in order to have the best possible plan experience. We have a dedicated customer care team that will help you with anything you need related to the Humana plan. They can be reached at 1-877-889-9885, Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. Once you've received your card, you can also register on humana.com and sign up for the mobile app. To learn more about the Humana plan, please visit the OGB website, and you can view a more detailed recording that will go in depth on the details of the Humana plan. Thank you again. Stay safe and be well.